be recorded, so welcome. Today's webinar is on mental health. We're so happy everyone joined us. And our special guest today will be NAMI, which stands for National Alliance on Mental Illness. Just to note a little bit about NAMI, they are one of the largest grassroots mental health organizations in the United States. Founded in 1971 by Harriet Shelter and Beverly Young. They were two young mothers. The reason they started this organization is due to the lack of resources and support that individuals had with families dealing with mental health. And right now there's 600 local affiliates large. So congratulations to NAMI. And we are grateful to have our presenter today by the name of Ms. Cassie Fay. She is the program director. She's been with NAMI, I believe since she became the program director in 2020. She's a licensed independent social worker, certified clinical trauma professional. She's presented both locally and national on trauma-informed care, arts in health, and social emotional learning. Just to know a little bit more about Miss Casey, and I'll turn the floor over to her. In her free time, she enjoys getting on stage, local theater, exploring the messy vintage shop, and telling her dogs how cute they are. With that said, welcome Miss Casey Fry, and I'll turn the floor over to you.
Wonderful. Thank you so much. And can I just get a thumbs up that you can see the slides and just the slides? Perfect. Thank you. Hi, everyone. So again, my name is Cassie Fye. I'm the program director here at NAMI Greater Cleveland. And I'm really excited to spend some time together and to talk about mental health. And I always want to make note, because this presentation tends to range anywhere from 30 to 50 minutes. And by no means is that enough time to cover the full scope and nuance that exists within just the topic of mental health. So I just want to encourage you all to, push into anything that might spark some curiosity for further learning. I do have some materials that I can share with some resources following this, and hopefully those resources can get you connected for further support, further learning, and we will work today to cover a little bit about some common mental health conditions, and hopefully maybe get into a bit of communication and how we talk about mental health and the language that we use around mental health. And then we'll have some time for some questions. So again, we have this lovely introduction about NAMI, which saves me some time, and that's beautiful. So we are the largest grassroots organization in the States. At NAMI Greater Cleveland, we service all of Cuyahoga County with the NAMI programs and services. And then we have, what we refer to as NAMI affiliates, like NAMI Summit, NAMI Geauga, NAMI Lorain, and they service their counties with programs as well. I will just do a brief overview of some of our big programs that we do offer. But before I give some of that insight, I always like to highlight the two biggest pieces that I feel makes NAMI very unique in the services and way that we present services to the county. One is that our services are completely free. There's never any conversation around insurance or billing. It is just free. So it is a huge relief to some common barriers that exist within the mental health, behavioral health field. So that is always one of my favorite things to share. The other unique piece about NAMI is it is primarily comes from a peer lens. While we have education programs like this, where we present for organizations in the area, we also offer free monthly webinars on various mental health topics, both in English and Spanish, and those are with trained clinicians. But outside of that, our work is really done through volunteers who live with mental health and or identify as a family member or a loved one who is caring and supporting a loved one who lives with mental health. So we have over 120 current trained and onboarded volunteers who live, work, and play in Cuyahoga County, and they lead and facilitate our programs every day across the county, virtually and in person. And so the programs really focus on sharing lived experience and valuing the expertise that comes from lived experience. While of course it doesn't overshadow the importance of having that clinical and academic lens, it's just a different type of support and expertise that you get, and that extends to our staff and our board as well. So even within my role, I spend a lot of time within our programs talking to various groups in the community about my own personal lived experience with depression and dealing with suicidality and various things. And it's become, hopefully it helps to break down some barriers to how we view mental health and the perceptions around mental health, which we'll get into here shortly. Some of the big program pieces that we offer are support groups. So we offer that for peers, which would be an individual who lives with a mental health condition, and that could be diagnosed or just kind of like self-diagnosed. You know that you deal with anxiety, you know you deal with depression. Those are just open to people who actually experience those symptoms and want to come together with others dealing with that as well. And then we also offer family support groups, and family encompasses friends, spouses, caregivers, anybody who is working to support and love somebody who is impacted by a mental health condition, because we know that doesn't exist in a vacuum, and it impacts loved ones as well. So it's space for them to get together, talk through strategies, self-care opportunities, and find support with people who truly understand what it means to live in that experience. And these support groups are offered in person and virtually. And we have some general ones, but we also have some more focused groups. Like we have a Spanish-speaking support group. We have a support group called NAMI for African American and Black members of the community. We have 2 groups at the LGBTQ Center, one for 55 and older, and the other is general to that population. And we have like an art journaling group. So there's some kind of focused ones and then just more general ones as well, to try to meet as many of those nuances within experience as possible. Our education services, we come to speak to different groups like this, to staff members at various organizations. We participate every month with the crisis intervention training and speak and share our stories to the Cleveland police officers, as well as the police academies in Cleveland and Cleveland Heights. And we are also in the hospital every week. We go to a variety of psychiatric floors and have people who were previously hospitalized for a mental health crisis go and share their story and resources to folks who are about to transition out of a hospital stay, to hopefully inspire some hope and connect to resources, just to let them know they're not alone in this journey. And then the last piece that I will share forever and ever is our helpline. So we have a fully functioning helpline that's operated Monday through Friday, 9 a.m. to 5 p.m. And you can call and get directly connected to resources and services that truly make sense for you and your needs. And what I mean by this, if you've ever needed a resource and you've gone on Google just to see what even exists, what are the programs around me, what do I even qualify for, who takes my insurance, what's the cost, is there a cost, all of these questions when you're already under stress is really difficult to navigate. And you can call the helpline and they will navigate all of that for you. They'll ask you some questions about what your specific needs are and get you connected to services that actually will work with what your situation is. And that's not just around mental health. It could be for housing, legal advice, workforce, food insecurity, all of it, because we know all of those things impact our mental health. Again, this isn't a crisis line. So if somebody calls in a mental health crisis, we will directly link them and contact the crisis line through Frontline or 988 with them to make sure they get the proper assistance, because this is just information referral. So I love to share that out anytime, because it is a huge help just navigating all the changes of programs that exist and change and organizations that exist and change. So definitely reach out to them with any needs. All right, so we're gonna jump into our first part, which is around stigma busting. So one important thing to know about NAMI is that we're really in the business of stigma busting, which means that we're going to do a little bit of that here today by addressing some myths, sharing some facts, and just providing some education around mental health conditions. So if stigma is a new term for anybody, the definition is that it's this mark of kind of a disgrace associated with a particular circumstance, group, or person. And so we still see a lot of stigma around mental illness. And it's this kind of societal perception, beliefs, and ideas that we hold about somebody with mental illness. And often viewing people who deal with that in a negative way because they have a mental health condition. And so it's important when we're talking about stigma, and I'm sure many of you are aware of this existing, not just within the mental health, but for other things. We have a lot of like judgments and pieces that we have, but somebody with mental illness can experience this externally in how people might talk about mental health, or if they do share their own mental health experience, that people might view them different or think that they're not as competent, or X, Y, or Z, fill in the blank. But we can also experience stigma internally, which means that we spend a lot of time judging ourselves for having a mental health condition. And those two often go hand in hand, because we're being fed narratives and messages from the community and how mental health is talked about. And in some cases, there might be a belief that, if somebody would just kind of get their act together, like work a little harder, get a better routine, stop being so negative all the time, then this mental illness would go away. And if we would take that in and we're internalizing that, then the only thing left that we have to really blame is ourselves, and that it is a personal deficit and something that we have control over. And we have to acknowledge it's called mental illness, which even that term, some people don't like the term mental illness. They'll say mental health conditions, mental wellness, emotional well-being, because there's stigma attached to all of it. But it's called mental illness because just like any physical illness that we may experience, it is something that happens within us that we don't often have control. Like I can't switch and not be depressed anymore. I can't switch and never have anxiety anymore. There are physiological and chemical things happening that, no matter how many boxes I check, I might be able to improve symptoms, but it is an illness just like other physical illnesses that we might experience. So I want to talk a little bit about stigma and just have folks kind of consider, and if you want to do one of the little thumbs up emoji things in the chat, that's fine, or just kind of internalize. But just a short poll for people to consider. So, you can think to yourself or do kind of a show of hands with the emojis, if you will, if you've ever sent a card to somebody who was sick. Or maybe they were injured through some accident. So you send them a get well card of some kind. And now consider or raise your hand if you've ever done, like maybe you sent flowers to somebody who had surgery, or you brought a meal to somebody who is recovering from surgery, or who went through, is going through chemotherapy, might bring meals and flowers and these get well cards. These are typically pretty common experience, and most of us have probably done that a time or two in our lives. So now we want to consider if we've ever done those things for somebody who was hospitalized for a mental health crisis. Or do we send flowers for somebody who completed a 30 or 60 or 90-day inpatient or outpatient treatment for their mental health episode? Or a card or celebration of somebody starting psychotherapy. Those are things that we probably haven't really done. And maybe some of it is, well, I haven't had the opportunity, but I probably would. And that could be true. We're talking about stigma, and stigma means that people are going to pause before they share this experience with others because there's a fear of how they will be perceived. So this little poll is really just to illustrate where we can still go to support the mental health of our loved ones and people that we know in the community. Similarly, if we were to support them through some type of physical illness, which doesn't carry the stigma and somehow is almost separate, when we know the things really go hand in hand. You can't separate the impact of your mental health on your physical health. We know our mental health impacts our physical health, and we know our physical health impacts our mental health. The brain is a part of the body, and so just working to identify ways that we can still encourage and show support for people who are dealing with the mental health pieces as well. So there's a saying that NAMI has that says no one brings casseroles. And that's just this idea of like stigma is both what we don't do and like maybe seeing people living with mental illness, showing kind of the same support and concern that we would provide to somebody experiencing other medical conditions. But it's also what we do, like our word choices and our perceptions, or paying them less wages, restricting their quality to different like quality jobs and so forth. And many of you, if I say, if you hear the word mental health, what are some words that you would associate with mental health? And you can type those in the chat. And they might be rooted in stigma. So I'm not saying they're going to be nice, nice words, but what are some words that you associate or kind of pair when you hear mental health? We'll see if we get an answer or two in the chat. Overwhelmed. I see overwhelmed. So most of the time we're going to see, like if we would see somebody and we're talking about someone, anxiety, we wouldn't say, oh, that person has mental health. Usually we have other words we'll use. So we see overwhelmed, anxiety. Keep this up maybe so I don't move that. Most of us have probably heard terms like crazy. Oh, I see stress. Yes, great. We hear terms like crazy, psycho. You know, we've probably all heard that type of language, and that's really stigmatized language. And you can consider if you're somebody dealing with mental health and you're around a group of people who are throwing around the words like, oh, that person is crazy, or that, oh, she's psycho, or all of those. I'm not going to be likely to tell anybody in that space that I'm struggling with mental health, because they told me enough about what they think about mental health or people with mental health. And so that's how language can become very stigmatizing, and what really can create a barrier for people seeking help. And they could wait years and years and really struggle and suffer in silence. And some, never ask at all, unfortunately. So our language is important, and not holding the mental health piece as a personal deficit. And that's how we can do a bit with how we use our language to kind of show people like we're a safe person to talk about this with. So this is bringing up a brief study that was done in 2014. And this study found that about 40% of the 60 million people who reported some type of symptoms with mental illness go without any treatment. So nearly half of the people who experience negative mental health symptoms do not get treatment. And of course, that can be contributed to things like stigma, and just how we talk about mental health, both like as a whole society, but also within our own kind of smaller community circles. And that can be a barrier. We can also assume that part of this lack of treatment is probably associated with issues around just access to service, cost of service, and those type of pieces, lack of like language options, and culturally relevant programs. So there's a variety of reasons why people might go without treatment, but stigma is definitely a part of that and plays a role in it. So having these conversations and this education about mental illness, and recognizing it as a medical diagnosis that is responsive to specific treatments, can really help decrease a lot of the negative stereotypes that exist, and that keep people from getting help. All right, so what is mental illness? So mental illness is a health condition involving changes in emotions, thinking, or behavior, or a combination of these. It's associated with distress, or problems functioning, whether that's at work, within your family, or social situations. So it is important to recognize that everybody has mental health. Experiencing things like anxiety before, something big, a big presentation, or experiencing anxiety when you have a life change happening, experiencing depression when you are experiencing grief and loss. Those are all normal emotional responses to situations, and we all experience those. When mental illness becomes to the level of like a diagnosis, and we're wanting to explore treatment options, that is because those symptoms have overwhelmed so much of our day-to-day life. It impacts the way that we show up, if we can show up to work, and how we show up to work, or it impacts the way we maintain or hold relationships, whether that's within our family dynamics or social. It can rob us of our interest and hobbies, and we start to detach. So this is important to note, that we all experience mental health, and the mental illness really comes when it is overwhelming our quality of life and our day-to-day life. So just to share some facts about mental illness, we know that when a person is experiencing a state of wellness, they function in a healthy way. They work in a productive way. They cope with life stresses. They contribute to their communities, and they have hope and kind of realize their full potential. That's all a healthy quality of life for people. Mental illness are these health conditions, like we said, that involve changes in our emotions and our thinking and behavior. And those are often associated with distress or just and create those problems in functioning in our day-to-day life. So these are mental illnesses are serious medical illnesses, and they're more common than medical diagnoses like diabetes and cancer and heart disease. Mental illness are more common than those illnesses. And one of those facts that are on the screen there is that 1 in 4 adults experience a diagnosable mental health disorder at any given time. So when we're in spaces with people, we can, based on the research and things, 1 in 4 individuals would have the symptoms that would meet criteria to be diagnosed with a mental health disorder. Mental illness can happen to anybody, regardless of age, race, religion, income, fill in the blank with the identity. However, it is important to note that those experiences of mental health become nuanced based on identities that we hold, and how different communities of people or groups of people talk and address mental health looks different. And so we still want to be exploring treatment options that are meaningful to each individual. And often that means exploring culturally relevant treatment options or faith-based treatment options for some folks, and so forth. Mental illness can strike at any time, including your adolescence and young adulthood, and individuals who are kind of at the prime of their lives. There's a variety of things that we know contributes to a mental illness. The research definitely shows that there is a genetic component. So often we see mental illness running through generations of family members. But we also know that things like traumatic experiences, things like isolation, and lack of community and all of that, they can all really spark a mental illness and symptoms. So it doesn't just exist because of one thing. There's a lot of pieces that contribute to that. And then the last fact that is always important to note is that with treatment, recovery from mental health is possible. And it's important sometimes when we use that phrase recovery, we have a very finite view of what that means. And recovery doesn't necessarily mean an absence of illness. And that's across the board, not just with mental health. But it does mean the highest quality of life. And that idea of what wellness and recovery is really up to individuals to determine what that quality of life looks and feels like to them. But we know that with treatment, people can live really healthy, successful, happy lives with the right supports and tools. So again, recovery is possible, which is always important because it's a challenging thing. And I will just speak from my experience, like as I shared, as somebody who lives with depression among some other things, that it was a difficult thing to realize that this wasn't a quick fix. There weren't these like checklists of things I could do and then never experience depression again. It is extremely difficult when I'm in a depressive episode and I am going to therapy and I'm engaging in my coping skills and I'm being social and I'm taking medication and I'm doing all of the things within my toolbox, and I still am feeling depressed. And the thing that gets me through is knowing that those tools leave me in a much better space than without those tools. And knowing that recovery is possible, that it's not something that has to consume and really take away my quality of life. And I think for people who live with this, and even family members and loved ones who watch a loved one struggle with mental health, we have to remember that recovery is possible, because we need that hope to get through those hard days with it. I think we'll probably wrap up here soon so we can do some questions. I was just checking our time. So some common mental health diagnoses. And again, this is a specific criteria that is met and evaluated through assessment by a licensed clinician and meeting this kind of list of symptoms often within a certain time frame to make sure that we can acknowledge the overwhelm and kind of deficit that it is bringing to the day-to-day life and well-being. So just quickly, some of those common mental health diagnoses are depressive disorders. So we have major depressive disorders, persistent depressive disorders, and these affect about 15 million Americans. So it's like 5 to 8% of the adult population in a given year. You would see kind of persistent moods like just kind of sadness, loss, isolated, probably a low sense of self-esteem or worth, decreased energy. You can see changes of appetite or weight, problems sleeping, difficulties concentrating, and these level of symptoms really interfere with a person's ability to function at work or school or family. This could be, when I've been in these states, I could go weeks and sometimes months without talking to friends and family, because I'm just in this very isolated state. And I've lost interest in hobbies that I enjoy normally. And I'm just kind of sad, like and frustrated at being sad. It's a very messy place to be, but we know that this depressive disorders are actually the leading cause of disabilities within the U.S. and many other countries. But again, recovery is possible, and these disorders respond really well to modern medicines and treatment like talk therapy or a variety of other therapeutic outlets. We have bipolar disorder. So we have bipolar 1, bipolar 2, and cyclothymia. These affect about 5.3 million adults. So roughly 2 to 3% of the adult population is impacted by bipolar disorder. And the signs that you see with this is usually you get very low depressed states for several weeks that alternate with episodes of irritability or just elevated moods. Sometimes we might see these higher irritable states, and we refer to those as mania. And you might see rapid speech and lack of sleep and just not needing sleep and impulsive behaviors. So it's really this big up and down, up and down. And those like bipolar 1, 2, and cyclothymia are just subtypes of the bipolar 1 being kind of the most severe of those. Let me just see. I think the last one that I'll talk about, because I want to leave space for some questions, is around anxiety disorders. So we have generalized anxiety disorders, phobias, panic disorders, and a PTSD. The predominant symptoms of anxiety disorders are excessive fears, symptoms that really interfere with a person's ability to function again in their day-to-day life. Generalized anxiety symptoms include just excessive worrying about multiple areas of life, work, family, social. You'll often see physical symptoms, again, because the brain and body are all one. So the physical symptoms are things like fatigue or insomnia, muscle tension, just a restlessness, very like fidgety often. Phobias then are an excessive or just kind of unreasonable, persistent, and intense fear triggered by a specific object or situation. Panic disorders then are sudden onsets of extreme fear with the physical symptoms, sweating, nausea, dizziness, racing heart, muscle tension, all of that. And typically if somebody has like a panic attack or an anxiety attack, especially the panic attack level, people will often say that they felt like they were dying, like they were having a heart attack. They need to go to the emergency because the body is really in a state of overwhelm. And PTSD can occur after exposure to an extreme traumatic event. But just because somebody's experienced a traumatic event doesn't necessarily mean that they're going to have a traumatic response like through PTSD. But if somebody was to have PTSD, those symptoms include just change in behavior, their thinking, reactivity. You might see some isolating there, and just trying to avoid possible triggers to whatever that fear might be. So again, like I said, we don't have the time to dig into all the ins and outs of this topic, but the big takeaway that I will kind of end before we do some questions is just remembering that that recovery is possible, and understanding that people in your life are probably have or are dealing with mental health that you probably haven't heard about because there's stigma attached. So if you're able to kind of be aware of the language that you use and how you speak about mental health, if you're able to you know, engage in more opportunities like this where you're getting some education and being able to have some different perceptions and language around mental health. Those are all ways that we can continue as a community to support individuals who are impacted by this. And, you know, there's plenty more resources and opportunities to learn through NAMI and other amazing organizations here in Cuyahoga County. So I do thank you for listening with me and learning with me. And I'm happy to explore any questions that I'm able to. Go ahead and stop sharing my screen
Okay.
here.
Thank you, Ms. Fye. We truly appreciate that wonderful presentation, and also sharing your personal story. It was very, very insightful and very informative. And it just also was a compassionate story to reach out to others who may be struggling with mental illness. With that said, we have a few questions in the chat. The first one is from Anna Santiago, my administrator. She's asking, is NAMI only available for Cuyahoga County? How about Lake, Medina, and Geauga?
Yeah, great question. So NAMI, like I said, serves NAMI Greater Cleveland serves just Cuyahoga County, but there is a NAMI Lake, NAMI Geauga, NAMI Summit, Stark, all of those pieces. So you can always like Google NAMI and the county to see if it exists. I think there's close to 30 NAMIs across Ohio. But again, if you want to not do the Googling yourself, you can reach out to us directly and we can connect you with somebody at a NAMI in a specific county.
Okay, possibly can even drop your information in the chat.
Yeah.
Um, the next question is from, let's see, I guess it was from me. As I had, oh, I'm sorry, I missed Miss Johnson's question. Is she stated, I've heard the term tapping. Can you explain what this is and as it relates to mental health?
Sure. So I will do a Spark Notes version of an explanation because it's not something that I personally have had training in, but essentially tapping refers to a process that helps, it's a mind body technique. So, and it's usually a part of EMDR therapy. And so there's different points on your body where you could tap, and essentially it would help kind of activate your parasympathetic nervous system, which is the part of the nervous system that helps to calm our body. So tapping is one way that we can kind of get ourselves out of a state of panic, anxiety, those type of things by connecting to our body. So some people might tap here. I know there's like some hand tapping. I don't know all the specific kind of trigger points, if you will, but by doing that, it helps trigger that calming part of our nervous systems and gets us back kind of at our normal state. This can also be done through things like rhythmic movement. So like taking a walk, music is good, like humming, singing, might do some push-ups or jumping jacks if you feel like it. Just kind of anything that gets us moving in a rhythmic way has been shown to help get us out of that anxiety state. And tapping is one of those tools that people can use.
Thank you. Okay, the next question or questions in the chat is from myself, yours truly. And it's basically in reference to assisting a loved one. How do, just want some support or assist an individual or loved one struggling with mental illness, A. And B, how do assist an individual afraid to come forth, knowing they're struggling with mental illness, knowing they're hurting inside. They're afraid of the stigmas related to mental illness, please.
Yeah, awesome. So for the first part of, how do we help somebody struggling with mental health that we, a person that we love and care about? I would start by just expressing concern and, whether it's a level of comfort on your end or just where you feel like they are in talking or using phrases like mental health, mental illness, those type of things, you can come at it from more of, I'll say like more of a distance and just say, I feel like I've seen you seem a bit down lately, or I haven't seen you like the spark that you normally have. Like, is there something going on? And just kind of approaching it as how the change maybe that you have seen in a way that shows they're struggling and you care and you want to know what's going on and let them know that you are support for them. And being okay to ask some open-ended questions. One of the pieces, and this is connected obviously to mental health, but when we have trainings around like suicide prevention, for example, it can be because of stigma, because of how we aren't as open about mental health. You may have concerns about somebody, but not want to ask because you don't want to offend somebody, or you don't want to have that like uncomfortable, like, oh, I don't want to overstep. That's not my business. And if the worst thing that comes out of you asking about somebody's mental health is that you're a little uncomfortable for a couple of minutes, but you have been open to provide this avenue to talk and possibly get somebody connected to resources or just feel comfortable to say it to someone, in my opinion, that's well worth a little bit of discomfort, and it does take some practice and coming up with, how do I ask my loved ones when I see them struggling? You know, are you okay? For me, I will also say, if you have lived experience, if you've struggled with anything like that that you can relate, it's always a powerful thing to model talking about it and making that a norm within your relationship. Because then if and when things are bad, you know, you've kind of practiced this or created this way of talking, and just encourage seeking help and all that. For somebody who doesn't want to seek help, um, it's such a tricky place. We talk a lot within the mental health field around self-determination, which means we can offer education and resources and support all day, but if a person hasn't decided that they're ready to take those steps or go that route, we can't force anybody to do that. And so being patient and just caring, you know, caring and being patient and being open to if and when they would get to that place is helpful. And I think it's powerful then to make sure you're caring for yourself, because witnessing a loved one deal with that, especially if they don't want to seek treatment, weighs heavily on people, which is why we have the family groups, because a lot of treatment and resources and programs are geared towards the person living with it, which makes sense. But there's not a lot of opportunity to support the people who are supporting the people. And we know that there's burnout, and we know that there's compassion fatigue, and that we worry about our loved ones going through it. And so as a family perspective or a caregiver, a loved one, you also need space to care for yourself, and process through. So also just doing what you need to maintain your own wellness and health. And sometimes that could be some boundaries or you know, therapy for yourself to just talk through what's going on. But you deserve that support as well as loved ones and caregivers.
Wonderful, wonderful. And again, we appreciate you being transparent about your personal story as well. Next, we have a two-for question from Ms. Bales. Does NAMI have a mobile crisis team? To piggyback off what you said before, and what is the number, the phone number to the NAMI helpline, please?
Right. I'm going to put the website, and then I'll get the helpline as well. So on our website, you can obviously check out all about NAMI Greater Cleveland. We have a calendar that has all of our programs. And like I said, those are completely free. So you can register, come try it out. Let me get our helpline. I'll be here. So NAMI does not have a mobile crisis team. Our focus is more around the support, education, and like information and referral. That's kind of our role within the behavioral health field. So we don't do some of like the clinical treatment or the crisis treatment, but we do link to those services when needed. So if you're looking for like the mobile crisis, that's operated through frontline services. And then of course you can contact 988 as another crisis line. You can text or call 988, and they would be able to get you connected as well to those crisis services within the area.
Excellent. Thank you. Okay. Lynette Crawford would like to know, does lead poisoning, at an early age lead to mental illness in children?
So again, this will be like my general, because it's not an area of expertise, and I'm always careful not to overstep and share misinformation. But we do see a connection between lead poisoning and mental health symptoms, and that I think that has been documented through research and things around that. So we do see a connection between those pieces, but I don't know the ins and out of all that. Beyond that, I know childhood exposure to lead can be linked to both mental and behavioral development changes. So,
Okay, excellent. Just to note, Miss Fi does have a survey at the end of this where you can start copying it now if you so choose to. She has a survey for everyone. She's asking them to participate. We'll move on to our next question, but would you like to share about the survey, Miss Fi?
sure, I'll just say that it is short and sweet. It's anonymous. There are parts like you can leave blank if you don't want to share. This just helps us to continue providing free opportunities like this in our program. So it just gives us some feedback as well to make sure that what we're offering is actually beneficial and helpful to the community. So we really appreciate you taking a minute to click through and fill out what you are able to.
Okay, and thank you. And for our last question, I believe in the chat, thought I saw one. Yes. Miss Mercedes Thomas, one of our case managers here, is asking, is there any information on supporting a loved one with mental
Yeah,
health?
I would direct you check out. So we have a full resource page on our website that has tons of resources. If it's something that you're willing to try out, I would highly recommend checking out one of our family support groups. Again, those are virtual or in person. And even if you just want to log on and see what it's about one day, you don't have to there's no everybody has to share. It's really about collective group wisdom and kind of what people are bringing that day. And the facilitators are just trained to make sure that conversation is healthy and people are heard. So I would also recommend checking out one of those support groups. Again, those are ran by our volunteers who have that lived experience, and there's a lot of shared strategies and resources shared in those groups as well. And you can always call the NAMI Greater Cleveland helpline for specific resources.
Excellent, excellent. Are there any more questions? Any last minute questions? Anyone else? Okay. All right, with that said, we want to give a huge round of applause to our featured guest, Ms. Cassie Fay, again, who is the program director for NAMI.